Hello, everyone, and welcome to Episode 4 of Blood Cancer Explained, an ongoing series exploring the blood cancer landscape. The goal of this series is to engage in a discussion about blood cancers, discuss the unique experiences of these patients, and provide resources for patients and their caregivers as they navigate this journey. In prior episodes, we've discussed how blood cancers and their treatment may differ from other forms of cancer. We've also touched on the emotional impact of a diagnosis and how medical and advocacy communities can support patients and their loved ones. We're pleased to welcome you to the series' fourth installment, hosted by AbbVie.
Hello, my name is Ilke Limonju. I'm Director of Communications and Public Affairs for the Oncology Business Unit at AbbVie. At AbbVie, patients and their caregivers are at the heart of our work. We are dedicated to driving awareness and understanding of topics important to the blood cancer community, and the following conversation is part of an ongoing series of discussions we call Blood Cancer Explained. With Blood Cancer Explained, we hope to educate the general public and those impacted by blood cancers on these types of cancers. And we also hope that it will broaden understanding and awareness of the unique nature of these cancer types. At AbbVie, we're committed to holding space for these types of conversations and elevating standards of care. We recognize the enormous impact of a blood cancer diagnosis and the burden it can place on both patients and caregiver. In today's episode, the complexity of acute myeloid leukemia, also known as AML, and the importance of the caregiver in the patient journey will be our topic. We hope that this conversation will provide important perspectives and information for patients and their caregivers about the resources available to support them through their care journey. With that, I'd like to introduce Samantha Nayar, Network Director of the Acute Leukemia Advocates Network, who will be joining us today. Thank you for joining us, Samantha. Would you take a moment to introduce yourself, please, and share more information about your organization, otherwise known as ALAN?
Thank you, Ilke. My name is Samantha. I'm the Network Director of the Acute Leukemia Advocates Network, known as ALAN. And ALAN is a global network of patient organizations. As today we have 56 members across the globe, located in 52 countries. Our role at ALAN is to assist our members in their work in supporting patients and their family, also to raise awareness of leukemia, but also to conduct work that is best done on an international level, like generating data and evidence. Everything that we do is patient-led, collaborative, and evidence-based.
Thank you, Samantha. Let's dive in. Samantha, can you explain to us in simple terms what is AML and how does it differ from other types of blood cancers?
Leukemia is a type of blood cancer. It affects the white blood cells, and the white blood cells are typically fighting infections. We can split leukemia into several different types, depending on how fast they progress, but also on the type of cells that they affect. Acute myeloid leukemia, also known as AML, it's a very aggressive type of blood cancer that forms in the blood and the bone marrow, causing the body to produce abnormal and immature white blood cells. Because the disease is acute, fast-growing, the white blood cells grow out of control and rapidly disrupt the growth of healthy blood cells. AML is one of the most common types of leukemia in adults, accounting for about 25% of all leukemia types. We estimate today globally that we have about 200,000 cases of AML diagnosed globally each year, and we also see that it is more commonly diagnosed in developed countries. We also know that it can be diagnosed at any age. However, we see AML is more common in adults over the age of 65 and is far less common in children. In general, we also see that the risk of AML increases with age. So signs and symptoms of AML can be very different across patients, but they are usually vague and non-specific, so that makes it even more complex to get a diagnosis. They may include loss of appetite, unexplained weight loss, fever, but also signs and symptoms of altered function of the blood cells. So you can feel tired, shortness of breath, you have frequent infection, night sweats, easily bruising and bleeding. Fatigue is actually the one which is most commonly reported. ALAN has been conducted a global survey in about 400 acute leukemia patients and 200 of their caregivers. And what we have seen is that about 90% of patients and caregivers did not know that the symptoms that the patient was experiencing could be linked to leukemia. So it's important to talk with your doctor if you experience any symptom or if you know anyone who experiences symptoms, to encourage him or her to consult a doctor.
An AML diagnosis imposes a significant burden on both patients and their families. Samantha, can you share additional insight on the patient perspective that follows after a diagnosis of AML?
The leukemia diagnosis, and especially AML, is a shock, and it has a huge impact on the patient life, also on the caregiver's life, including quality of life, physical, emotional well-being, but also finances. In our survey, we have seen, for example, that about 80% of people who were working at the time of diagnosis had to stop working. Our surveys also help to identify which demographic factors are more impacted by AML. Younger patients, female-identifying patients, and patients with lower income reported a worse quality of life than the others. Interestingly, we have not seen any major differences across countries, region, despite the fact that healthcare systems are quite diverse. In addition to physical symptoms, about half of respondents reported that the side effects had a large impact on their quality of life. The survey also identified that patient quality of life was negatively impacted because they have reduced ability to carry out physical or enjoyable activities, they have a huge sense of isolation, and they worry a lot about being a burden to others. We also found out that patients are quite worried about the future, also to relapse, and the fear of dying is also very important for them. So given the burden of AML on patients and their family, part of our effort at ALAN, but also with our colleagues on national level, is to provide specific support to patients with leukemias, but also to their caregivers, by developing patient information, advocating for better treatment, provision of information, provision of emotional support, care and access to healthcare services.
Thank you for your support of the AML patient and their caregiver. Since AML is more common in adults over the age of 65, family members and friends often serve as forms of strength for patients throughout the diagnosis and treatment of AML. However, being a caregiver is not easy. In fact, caregivers also face a difficult emotional burden, in addition to potentially managing the daily tasks of their loved ones. Samantha, can you share additional insight on the role a caregiver plays and some helpful key learnings or resources you have at ALAN for caregivers to help them navigate the AML journey?
Yeah, sure. So when we speak about caregivers, we speak about family members and or partners. So we are speaking about informal caregivers, not professional caregivers. And what we see and what is being reported is that caregivers often play a major role in the patient journey. They are the ones who help the patient, but also advocate on behalf of the patient in front of the physicians or the healthcare provider, and ensure that the patient needs are actually addressed properly. In the work that we have conducted, we have seen that usually the caregiver is a partner living with the patient, but of course every situation is different. They do provide a wide range of care and support related to the treatment and the illness, but also to assist with everyday activities, providing emotional support, accompanying the patient to appointment, helping with the house, the shopping, the kids. So a lot of additional work is being done by the caregivers. And we see also over time that this can become overwhelming, and it can be very hard to balance the patient need and also the need of yourself as a caregiver. And we speak more and more about the burnout and the exhaustion in caregivers. We have actually seen with the data that we have generated that about 60% of the caregivers believe that caring for someone with AML has negatively impacted their well-being and their life. We also have seen that caregivers report a greater negative impact of leukemia on their own well-being compared to what patients report for themselves. And the same as for the patient, the caregivers report being very worried or extremely worried about the future, but also relapse, and they appear to be more worried and anxious than the patient themselves. Similarly to the patient, the carers report a negative impact on finances. About 30% of them who were working at the time of diagnosis had to stop working. Carers face physical, emotional, and psychological challenges, and since they are an important pillar of the patient journey, there's a great need to recognize them throughout the patient journey, but also consider their own needs. It's important for caregivers to look after their own well-being, physical and mental, and also to feel free to communicate with their loved ones if they begin to experience any hardship. Caregivers can also work with their healthcare team to find out about support groups that can offer emotional support and advice if they feel overwhelmed by their caregiving responsibilities.
A blood cancer diagnosis is difficult news to receive. It can be hard for patients and their families to determine what their next steps might be. An important first step is for patients and caregivers to talk with their healthcare provider and the broader healthcare team about the condition, testing that's needed, and available treatment options. Patients and their caregivers should be honest about any concerns they may have, and it's important to ask clarifying questions if they don't understand the information being provided. Samantha, based on your experience at Allen, do you have any advice for patients, caregivers, and their healthcare teams?
A blood cancer diagnosis is a challenging news to receive. What we hear from patients is that once they hear the word cancer, they cannot focus on anything else. And often they don't even have time between the learning of the diagnosis and starting treatment. In our global survey, we have found that at diagnosis, majority of patients and carers only partially understood or did not understand the information provided by the healthcare professional, leading about 80% of them using internet to find out more information about AML. In addition to that, we also find out that about 40% of patients and carers thought that they were sufficiently involved in decision-making about treatment and cares. The survey also identified that 40% of patients and 60% of carers were not provided or directed to written information on treatment options, clinical trials, monitoring, fertility, side effects, financial burden, emotional and general well-being, patient rights, but also end-of-life care. So the work that we have been conducted highlights the need of greater involvement of patient and carer in treatment decisions, as well as the need of emotional support for carers. So while we do encourage patients and their caregivers to keep notes in a journal of everything that is happening, like appointments, symptoms, what they do experience, emotion, question to ask, it's also important for the healthcare team to understand that once a patient and their caregivers absorb the shock of the diagnosis, they need to know that there are resources, that there are support groups, that information is available to help them understand all facets of the disease and the therapeutic landscape. We do encourage healthcare teams to refer patients and caregivers to patient organizations, but we also encourage healthcare teams to work with the patient and to work with the caregivers to highlight and reiterate the availability of the resources throughout the care journey.
Thank you, Samantha, for your time today.
Thank you for having me.
And for those watching, we hope that you found today's discussion meaningful and that you'll be able to use some of the advice shared during this episode of Blood Cancer Explained. Please visit Allen's website, acuteleuk.org, for more information, or visit AbbVie.com to discover our other videos and resources developed as part of our Blood Cancer Explained series. Thank you.
As a reminder, please note that the educational content of this video is not intended to be taken as medical advice and should not replace the recommendations and advice of your doctor. Please take a moment to review the disclaimer displayed on screen. Thank you again for joining us.